Thank you, Andy. October is Eye Health Month, and one of the best ways to see well is to eat well. Leah here now to put her health hat back on to tell us a little bit more about what we can take in. So it's more than just carrots, the old adage.
Absolutely, right? Carrots, though, are very good. We'll get to that in just a minute. So our lifestyles and diet play a huge role in the health of our eye. And actually, the eye is one of those organs of the body that you don't actually have to cut it open to get a good look at what's going on in your body. You can actually do that just with some pictures, and I'll show you some pictures a little later in this segment. But optometrists can tell a lot just from those pictures of the eye. For example, if you've got diabetes, high blood pressure, high cholesterol, or low iron. So when it comes to diet and eating well, optometrists can tell a lot just by looking at the eye. And this is all about preventing disease or maintaining your eye health as it is. So preventing diseases like cataracts, macular degeneration, or even dry eye syndrome. Depending on what you eat, those things can be prevented. So I spoke with optometrist Farrah Sunderji, and she says we need lots of nutrients for optimum eye health. So things like lutein, vitamins A, C, D, and E, and beta-carotene. That's the carrots. And here's how she suggests you get those.
I encourage patients to eat half a cup of kale or spinach on a daily basis. Other leafy greens such as collard greens are awesome as well. You can incorporate orange vegetables such as bell peppers, sweet potato, pumpkin, citruses, as well as berries. Other foods include salmon, sardines, mackerel, cold water fish on a regular basis at least twice a week. Eggs are a great nutrient for the eye.
And she also suggests things like nuts, like almonds and walnuts. And then she says what you really want to do is get the kids on this diet as early as you possibly can. And she says, sure, that's going to be tricky, especially with things like those dark green leafy vegetables like the kales. But here she's got a great tip that I thought was quite wonderful. She said, get the children to eat one fruit or vegetable from every color of the rainbow every day. So that's a good place to start.
Okay, what other things should we be thinking about?
Okay, here's the big one. So the other nutrient that we really need to think of for optimum eye health is omega-3.
So it's important you're taking an omega-3. 6 and 9 we get enough in our diet. Omega-3 is important because it's an anti-inflammatory, and it's especially important for dry eye syndrome. There are two different versions of the omega-3. There's a triglyceride form as well as an ethyl ester form. And I, in office, promote the triglyceride because it is a cleaner form and easier to absorb and digest.
So there you go, omega-3, we get enough 6 and 9 in our diet. Now these are the pictures I was talking about. So this is actually my eye, and that's Farrah telling me about what's going on in my eye. Now have a look at those blood vessels and arteries in my eye. Those are the long red branches she's pointing to right there. Those are actually very bright red. The arteries are nice and thick. The veins are very well defined. And that's a picture of my eye that suggests that I'm actually a very healthy eater and that I have low blood pressure. And the reason she can tell that, for example, is that those red lines, they would be thinner, a lot thinner, and they would also be less red in color. They'd even be actually white in some cases if you actually had high blood pressure or you had and you didn't have a good cholesterol level. So these are the things they can actually tell just by taking a picture of your eye. And of course, that's something that they would do for you at your annual visit. They're going to take a picture of the back of your eye to make sure it's okay back there. So the idea is basically to eat well and to live a healthy lifestyle for the best eye health. So she also says things to consider are these lifestyle changes. So just like all of the doctors are saying to help prevent disease down the road, she suggests quitting smoking if you smoke, exercising 30 minutes a day, and of course, because she's an optometrist, she says get your eyes checked annually to make sure there's nothing going on there.
Okay, the windows to the soul and to the health.
And to the health of your body, you bet.
More information on your blog, as always, breakfasttelevision.ca. That's where you can find it. Well, Mike Yanni didn't see any ghosts, but they may have heard some things. What stories do you have for us next?